You will now be placed into conference. Has joined the conference. The leader has muted your line. To unmute your line, press #6.
To make sure.
Okay, good morning, everyone. This is Anita Hester with DXC Technology, and thank you all for joining today's webinar. And on the line, I also have Brian Dowd, Rebecca Duggar, and Catherine Ivy with DCH. The line is currently muted to prevent any background noise. However, you do have access to the link, and hopefully everyone can actually see the opening slide of the presentation. And today's presentation is COVID-19 Appendix K Amendment, Retainer Payment Reimbursement Changes. And if you're having any technical difficulties, you can access the presentation on the GAMIS website without logging in. Go to the Provider Information tab, slide down to Provider Notices, and select the titled presentation. We do have a dedicated email address that we will present within the presentation that you can submit any questions that you may have as we're going through the presentation. You can also enter any questions that you have in the chat room as we go through each slide. So now, with that being said, I'm going to turn it over to Rebecca Duggar with DCH. Thank you.
Thank you so much, Anita. And again, good morning, everyone. Again, this is the Georgia Department of Community Health COVID-19 Appendix K Amendment, Retainer Payment Reimbursement Changes. I see that we have a very intimate group today. It's about 32 of us, give and or take. And so we'll probably try to do another one. If not, then of course this session is being recorded and will be available to you so that you can share with your colleagues or provider organizations. Next slide, please. Next slide. Thank you. We also did this presentation for DBH with DBHDD, our partners there. So if we have any now in comp providers that are on the call, hopefully you also had an opportunity to tune in there. They will also have the presentation located on their website, and so you can certainly access that presentation. A lot of information was provided to our provider network directly related to now in comp. So that's why you see that slide there. Next slide, please. And of course, we always want to make sure that we remind everyone of the mission of the Department of Community Health, and that is to provide access to affordable, quality health care to Georgians through effective planning, purchasing, and certainly oversight. Thank you so much again for being with us today. We understand that during these challenging times, a lot of things need to be addressed, and so we'll certainly try to get those things done today. So our objectives will be to reference those CMS FAQs posted as of June 30th of this year, and so that's the framework that we will have in terms of all of the information that we will share with you today. We'll also talk a little bit about the approved Appendix K amendment. There's been a few of those, and so we'll go through that timeline and any updates that have been made on each of those amendments. And then we'll also display the provider attestation statement for reimbursement and duplication avoidance. And so we're talking here about retainer payments, and there will be an attestation requirement, and so we'll dig a little bit into that and what that looks like. Next slide, please. And so, as always, we have to give this disclaimer because this is a moving target. We receive information daily in terms of what's going on and how we need to help our providers and members move forward. So the recording of the discussion is a snapshot in time, and due to the rapidly evolving nature of the emergency, additional information and implementation plans will be provided through FAQ pages. banner messages, and other published information. And of course, you can receive the latest COVID-19 guidance, including the Appendix K application and amendment, right here on the medicaid.georgia.gov/COVID-19 or dch.georgia.gov. And so that's where we have a lot of material that you're able to access and share with your colleagues and staff. Next slide, please. And so our agenda will be that we'll, again, look at the guidance on reimbursement of retainer payments. We'll review those FAQs related to the retainer payments. We'll also provide information on the approved Appendix K amendment. And as I stated before, certainly we'll display the provider attestation statement for reimbursement of duplication avoidance. Next slide, please. And so with that, we'll turn it over to Brian and Catherine to get us started. Brian, Catherine?
Thank you so much, Rebecca. Good morning, everybody. This is Catherine Ivey of DCH. And the next thing that we wanted to do was just run through the history of all the submissions that we've sent to CMS, what the purpose of them was at the time, and where we've evolved to at this point. You know, originally, right after the declaration of the public health emergency, DCH submitted 2 Appendix K applications to CMS. The Appendix K applications requested a number of things, not the least of which was retainer payments for providers who would experience shortfalls and would also experience a suspension of services as a result of the pandemic. Those 2 Appendix K applications covered, one covered the New Options Waiver Program and the Comprehensive Supports Waiver Program, and the other included the Elderly and Disabled Waiver Program and the Independent Care Waiver Program. The whole purpose was we were attempting to mitigate exposure risk that was posed by the COVID-19 public health emergency, to provide alternative service delivery models and options, and to preserve the provider network and the service delivery system. CMS approved those 2 waivers on April the 9th with an effective start date back to March the 1st. Then, after that, we submitted another Appendix K amendment to CMS on June the 2nd. The purpose of that was to request that we be allowed to continue retainer payments beyond the first 30 days, because we knew that providers were still not able to open their doors. And so we submitted that. It was one amendment to the Appendix K applications. It was a combined amendment, and it covered all 4. But CMS denied that application because we had asked for ongoing continuous retainer payments. So we did not have an end date in that particular amendment to our request for retainer payments. Next slide, please. Next, we submitted an Appendix K amendment to add a telehealth option to the Now and Comp waiver programs for community access and pre-vocational services. And CMS did approve that. They approved it with an effective start date of April 15th. And then finally, we submitted an Appendix K amendment to CMS following the FAQ release that we're getting ready to talk about. And we submitted that to CMS on July the 20th. And the request was to follow the FAQ guidance allowing 3 continuous 30-day retainer payment episodes. And CMS did approve that amendment with an effective start date of April 15th. Next slide, please. So here's the source. We always want you to know where we're getting our information and how we're translating that information into state of Georgia operations. So the CMS FAQ document is available on the CMS website. It was posted on June the 30th, and we've given you the website also the way it looks, so you know you're in the right spot when you go to that website, but also the actual link to that website to the FAQ page. Next slide, please. Now, we did not alter the retainer payment service type, So the approval that was in the original Appendix K application, and it was approved by CMS for each of the Appendix K submissions, was in the EDWP and the ICWP personal support services in all of their varieties, consumer-directed, extended, etc. In the now and comp waiver, that translates to community living support, and then adult day health care on your left side of the screen for EDWP and ICWP, which translates into all of the day services that are available through the now and comp program, including supported employment, pre-vocational, and community access. And then your residential services, which go under the name Alternative Living Services in the EDWP and the ICWP, and in the Now and Comp program go by the name Community Residential Alternative Supports. There's no change in that. Next slide, please. So there's also no change in the general guidance for all states, which is that retainer payments are limited to providers of personal assistance services, just meaning that any service that contains an element of personal assistance to the individual receiving care or services of that type is eligible. And so CMS goes on to say that any service, HCBS service, that supports ADL care or IADL care is eligible, and there's been no change to that. Next slide, please. Here's where the change comes in. The retainer payment guidelines for Georgia changed with when CMS released the FAQ page on June the 30th. The length of time that retainer payments could be used was defined as the lesser of 30 consecutive days or the number of days for which the state authorizes the payment bed hold. And when we questioned CMS about this further, they let us know that they would approve 3 30-day retainer payment episodes. And so with the July 27th Georgia Appendix K amendment, CMS did approve 3 30-day retainer payment episodes, which of course translates to a total of 90 days. That approval went retroactively back to April the 15th. Why did we choose April the 15th? Because that was the date that we determined would be the earliest opportunity for providers to have run out of the initial 30-day approval episode. CMS also confirmed that a staggered retainer payment model is allowable. So, for example, if your member originally was coming to your center, day center, on Monday and Wednesday, then you would still be able to bill and deliver services on Monday and Wednesday. Now, in these times when you've probably not opened your center back up yet, you could deliver that as a telehealth service delivery day. So Monday and Wednesday could be delivered as a traditional service day so that the person actually came into your center. If the person was comfortable with coming in and you had opened your center on a staggered basis, or it could be delivered via telehealth service delivery. Then on Tuesday, Thursday, and Friday, a retainer payment reimbursement could be requested by the provider with documentation that those particular days of the week were the reimbursement was related to retainer payment. That way, it allows you to be able to take this allowable 90 days much further out than the traditional 3 months would allow. So the consecutive days are those days that are eligible for billing. That part has not changed. CMS gave us guidance relatively early on that the retainer payment days would be those that were eligible for billing otherwise. Next slide, please. We have indicated on every slide where it originally started out and what changes we made based on the FAQs. So the retainer payment is going to be authorized still at the level, duration, and amount as outlined in the most recent service plan or prior authorization. And services can be reimbursed as a payment of retainer payment for 30 continuous days for the first 30. But then here's what's really different in red. Following the initial episode, providers can be reimbursed for 2 additional 30-day episodes for a total of up to 90 days. Next slide, please. So states that are interested in using the retainer payments, and there's no change to this, have to still ensure that the state has to assure that we have adequate controls on the reimbursement. And so here's what your part of that agreement is as a provider. If you're utilizing retainer payments in any quantity whatsoever, even if it were just 2 days of retainer payments, we have to assure that you have provided the state with an attestation that you understand that we must recoup retainer payments if other resources, once available, are used for the same purpose. We'll talk more about that in a little bit, and you will probably have some questions at the end about that. We have to collect an attestation from each provider who requests retainer payment reimbursement that they understand that they'll be subject to recoupment if inappropriate billing or duplicate payments for services occurred. We have to also require in that attestation that you have said that you will not lay off staff during that period and that you would maintain wages at the existing level. Now, I want to go back just a minute to the limit retainer payments to a reasonable amount. CMS said early on that states could choose to do any one of the following. They could limit reimbursement under a retainer payment at some percentage lower than the traditional rate. So many states opted to reimburse retainer payments at 75% of the retainer payment. We even heard of some states that had selected 50% of the traditional payment as a retainer payment. So they juggled and retooled their reimbursement rates depending upon whether or not the service was actually delivered as a traditional delivery model or if a retainer payment was requested. So like I say, some states limited it to 50% of the traditional rate and other states limited it to 75%, but Georgia did not do that. We opted to go ahead and offer reimbursement rates at exactly the same as if you had delivered the traditional service. So I just wanted to go ahead and mention that. Next slide, please. Just one moment. Thank you. So here are the other things that you will find in the attestation statement that we posted. The provider has to acknowledge that they have not exceeded their revenue that was received by that provider for the last full quarter prior to the PHE. So let's break that down. The full quarter of regular reimbursement prior to the public health emergency was actually October 1 through December 31, because the public health emergency was declared in mid-March. And so your very last full quarter of non-retainer, non-PHE payments was that last quarter of calendar year 19. They outline in the FAQs exactly where those revenues might come from. They could be found in unemployment benefits, in Small Business Administration loans, in CARES Act, Provider Relief Fund, etc. And so of those, all of those fund sources, and these would be fund sources that were not loans but required repayment, that your income, your net revenue did not exceed your pre-PHE net revenue, quarter by quarter by quarter. Next slide, please. Thank you. And so providers are subject to recoupment if inappropriate billing or duplicate payments for services occurred as identified in a state or federal audit or any other authorized third-party review. And then there's a note that duplicate uses of available funding streams means using more than one funding stream for the same purpose. Next slide, please. And so we also changed this slide, which is repayment of retainer reimbursement. So if, in fact, your agency has already billed more than 90 days in retainer payment, there are a couple of different ways that you can pay back that 91st day and beyond. One is to just void all claims that represent the 91st day of retainer payment or greater. The other you'll find outlined in Part 1, Policies and Procedures for Medicaid and Peach Care for Kids, under Section 407, and it outlines the guidance for recoupment of reimbursement. You can enter into a request a repayment plan, and all of that is described in Part 1. Next slide, please. So I'm going to show you just a minute a little bit about where you find the attestation statement, and then I want Brian to talk to you for just a minute about audits and what we expect may happen. We have put on the DCH website a fillable form to make this as easy for you as possible. And that fillable form is available at the website that you see on your screen. It's as easy as going into the DCH website, clicking on the COVID-19 information, and then looking for the Medicaid and Peach Care for Kids column that you see on your screen. Next slide, please. And under Provider Relief Fund, or you'll actually see the Provider Attestation Statement. You'll just click, and this is what it looks like when you get there. So you can select all of the waiver programs that you participate in, that you're enrolled to deliver services within, and you'll select the waiver program, and then next you'll need to select the services that you provide through that particular waiver program. That's a drop-down box, and you'll just add. So if, for example, you provide alternative living services and personal support, you'll just click the Add button and then add personal support. You'll be required to include your Medicaid number that is specific for that particular service, so with the alpha character at the end, and then list the number of retainer payment days that you as a provider claimed for that particular service under that particular waiver. Now, if I also do business in the independent care waiver, I'm going to do exactly the same thing, and I'm going to list the number of retainer payment days I've claimed in the ICWP for that particular service. So we'll call it PSS. Next slide, please. We're going to be putting out a banner message very shortly, within the next week, on exactly where to find this attestation statement and what the time limit to submit the attestation statement is. And by the way, it's October the 1st. We calculated out the length of time that if you were toggling or using intermittent retainer payments, you might be able to stretch that 90 days to, and by October 1st, you probably will have exhausted that. So by October 1st, we need for all providers who have submitted a reimbursement request and been reimbursed for retainer payments to have completed one attestation statement. We're going to retain those attestation documents, and now, Brian, if you'll talk a little bit about the audit documentation and what we need for them to do and what we expect to follow up on.
Sure. Thank you, Catherine. If we just go ahead and forward to the next slide. So I'm just going to hold here for a second. It is really important to note, as Catherine said, that you need to retain a copy of your attestation form in your records. Just print it out and retain it. You don't have to do an attestation for every single member. We've been asked that question. That's not necessary. Just one attestation per location is all we need you to do. I want everyone to hear that we do expect there to be auditing associated with the retainer payments. We have specifically been told by CMS on multiple occasions that our providers down the road should expect to be audited. I've been asked several times, well, you guys control auditing. It's through your Office of the Inspector General, or it's through your individual program audits, or through DBHDD audits. And that is true. There are auditing functions for fidelity of quality of services through our different policy sections. And there's also our Office of Inspector General who looks at fraud, waste, and abuse. But in addition to that, there are federal auditing mechanisms. And the most notable one is the payment error rate measurement audits, which are federal audits. We really don't have anything to do with them. CMS hires outside contractors with specialty in billing and in Medicaid, and they come into the states. We actually had them last year before the COVID-19 public health emergency. We had the PERM auditors on site at DCH for over 2 months, where they pulled records, they had all access to all eligibility systems, and they reviewed cases on a case-by-case basis. I would encourage folks, because I know there's a lot of anxiety out there around this, and I don't want there to be, I would encourage folks just to keep track. Keep track of the different payment funds that you are receiving. If it's a loan, that is not counted. We have verified that. But keep track of your retainer payments and your provider relief funds, and make sure that that funding isn't going past what you had in that October to December period before the public health emergency. I would anticipate, of course, that they not ask for all money back, just the amount that you were receiving over that amount, if you did even ever end up over that amount from the previous quarter. So I'll just continue on here with the slides, Catherine, if you don't mind that.
Yes, please, Brian, go ahead.
So this next slide also gives those providers, if you go back just 1 second, I'm sorry, to the previous slide, I just want to let people know that this is where the DBHDD operational guidance is. So we wanted to provide you with a specific link to the operational guidance. If you'll go forward 1 slide for me, I'm sorry. Wait, I think we're going back. There you go. That's the operational guidance. So we wanted to show you what it looked like and what the actual link for that was as well. If we go forward to the next slide. We also wanted to answer some of your frequently asked questions, which I know we have throughout our presentation, because we're kind of used to what you guys' concerns are, and we try and address them wherever we can. And the first question is, well, if I took retainer payments before this guidance, do I still need an attestation? And the answer to that question is yes. Anyone who took a retainer payment anytime during the public health emergency needs to fill out an attestation. I answered the second question. Catherine answered the third question, and it is a good one, so I'm going to re-emphasize it. Can we bill interim retainer payments? Yes. So I've gotten this question from several people. I got a random call to my phone this week where a provider told me that they had been doing some telehealth, and then there were some members that they weren't able to service, and they were asking me, in the interim of these up to 90 days, can I bill a retainer payment? Yes, we have got specific guidance from CMS that is allowed. The next question is, are the retainer days calendar days or business days? They are business days, so they are service days up to 90. So in that scenario, you could fill in the gaps from telehealth, Monday, Wednesday telehealth, Thursday, Friday, retainer payments, Saturday, telehealth, and you could continue to do the retainer payments in that way. The next question is, will we be audited? I've already addressed this. I would expect audits related to these retainer payments. Next slide, please. The attestation assets for no duplicate payments but PPE or PRF cover 100% of the expenses. So how do we attest when the funds received did not cover all the expenses? You really need to look at duplicate uses of available funding streams, which means more than one funding stream for the same purpose. What CMS is really looking at is, this is all taxpayer funding, right? And it's in the middle of a public health emergency when businesses are getting reduced funding and there's less tax revenue than before. So CMS is just really wanting to make sure that they're not paying more than they were paying before the public health emergencies, or they were paying for the same staff 2 or 3 times, which is a completely reasonable request for them to make. Can we delay retainer payments and use once PPP funding has been exhausted? If you have not already received revenues in excess of the PHE level, and you need to go in and bill those retainer payments, then absolutely that is allowed. Next slide, please. Can we bill retainer payments up until the date the PPP loan funding was received? So there's a lot of different examples here for this. I got a 4-page email yesterday where somebody was outlining the different scenarios. And what our response to this is, again, those 90 days are available to you to fill in your blanks or put in where you can't service somebody, but you do need to be keeping an eye on the fact that all your revenue streams that you do not have to repay do not exceed what you were getting before the public health emergency. Nobody should be making more money now based on not working than they were making before the public health emergency, is the easiest way to say it. If we acted in good faith based on guidance received at the time and billed retainer payments, but we're now being asked to complete an attestation saying we will abide by requirements we were not able or aware of at the time of billing, are we subject to recoupment? Unfortunately, yes, you are. The guidance from CMS is the guidance from CMS. And as much as we have had some changes in guidance here, some of it has been very good, like we can now bill up to 90 days, whereas before we only thought we were going to be able to bill to 44 days. But with that additional number of days, we also do have some requirements that we have to attest to and abide by. Next slide, please. This is also really, really important, y'all. And I know we've slowed down a little bit on responses, but we do try and respond as quickly as possible. These are our dedicated email line, medicaid.pckcovid19@dch.ga.gov. And again, we post these webinars so you guys can have, in full transparency, all the information up to real time. So if you have specific questions, please send them to this mailbox. Also, we wanted to provide you our DCH webpage because we have a dedicated COVID page on that website that you can get the latest information on. And this second link is resources for reopening non-emergency healthcare facilities. If you guys could make sure you're on mute, all of a sudden I'm getting some background noise. So if you could make sure you're on. Yeah, thank you. Thank you for doing that for me. So that's also resources for reopening non-emergency healthcare facilities. So that'll give you some CDC guidelines about what you need to do. Next slide, please. Again, this is our DCH website, but it also gives you the DBHDD website. If you are a now and comp provider, we would encourage you to go through DBHDD. We have been working in cooperation the entire time with the Department of Behavioral Health and Developmental Disabilities during the public health emergency, from the commissioner level all the way down, to make sure that we are doing, we are giving the same messages, and we're proceeding in coordination. Next slide, please. And that is our end of presentation today. I'd like to turn it back over to Catherine Ivy to see what I missed in that final section.
Brian, I don't think you missed a thing. We have a question in the chat box, which is, what quarter or span of months will be used to compare against the October through December revenue quarter, total revenue quarters? The answer to that is that technically January through March will be open to scrutiny against the October to December quarter revenues, and then separately April through June, and as we go forward into the PHE, then July through, what would that be, September. So each of the quarters that in which we find ourselves still in the public health emergency, nationally declared public health emergency, will be measured against your pre-PHE full quarter of revenues, which is the October through December. That is certainly the way we suspect that it's going to be audited, because you certainly can't audit revenues for a quarter pre-PHE against a 6-month period. That wouldn't be fair to you. So we're really expecting that all audits will be conducted on a quarterly basis in terms of revenues received. Brian, do you have any different information about that?
No, I am very confident that that is the way it will be done.
Right now, I'm not seeing any other questions. Let's see. Can you give an example of that? I'll try. Let's see. If you made $100,000 in revenue in the months that included October, November, and December of 2019, then in January, February, and March of 2020, they will expect that your revenues would not have exceeded $100,000. And then in the months of April, May, and June also won't have exceeded $100,000. Now, you may have a glitch in that for January, February, March, and that would be completely understandable, because often if you're a center-based provider, your revenues may be down in November and December because of the holidays. If that is presented as an argument to a CMS auditor, I would think, just my hunch, and Brian can disagree, but my hunch would be they would find that perfectly understandable. That January, when the next year begins, everybody starts to increase their attendance, whereas it might be down over the holidays. Brian, do you disagree with that?
Hold on one sec. We're getting quite a bit of background here. If we could mute all the lines. Yeah, I'm sorry, you guys.
I'll go ahead and take the next question, because we may be having a bit of a backwash in sound. Let's see. So one person says that her facility's been established since Q4 of 2019, but we didn't actually operate. So they didn't hire staff, they didn't have operational expenses until Q1 of 2020. So that's going to be a perfectly explainable situation to an auditor as well. So if you had little to no revenue because you had just opened in the last quarter of 2019, That's perfectly understandable. Now, the slides are going to be available on GAMIS under Provider Notices. That's where they're posted. And this is a recorded presentation, so it will be available under Provider Notices. There's a next question. If we received a PPP loan, a payroll protection loan, but have not received forgiveness for that loan yet, does the loan amount count as revenue? Remember that none of you will likely be audited until well into 2021. So you'll know by 2021 whether or not, at some point in 2021, whether or not that loan is going to be considered revenue because it was forgiven, or is it in fact going to require repayment? There's another question, if we have an individual that had CLS service in the afternoon and due to COVID the services were moved to during the day, can the day program still bill? We have specified in the Appendix K application that if the provider delivers both the day program service and the in-home service, same provider, enrolled for both, delivering both, then you cannot also bill for the day program when it's closed, because your revenues from your in-home service, in this case CLS or any other waiver programs, personal support, will have accounted for at least a portion of what you would have, your revenue would have been in day program billing. So that would be considered duplicative billing. Let's see. They're able to locate the presentation and can access the PDF version at www.mmis.georgia.gov. There's another question, how should we issue our new facility situation, or should we wait until an audit and then explain then? I would wait until the audit. I don't know that you're going to be able to explain that in a way that's historically kept. The audit will involve you as well, so just keep that record. Another provider says we're trying to determine if we can bill any more retainer payments if we've already taken a PPP loan. Unfortunately, we just can't answer that question for you because you won't know for a while yet whether or not your PPP loan is forgiven or whether or not it's got to be repaid. And so we just can't answer that question, and I'm sorry that puts you in a bad position, but nobody will know that for a while yet. I don't see any other questions in the chat box right now. I'm going to give it over to Rebecca and see if Rebecca has anything else she'd like to say before we close the recording.
No, I don't. Thank you so much. There is, again, I do want to remind everyone, and I think that slide is up. If you do have questions that you go back and want to think about with your colleagues and staff, please use that COVID-19 mailbox. We do monitor that, and we respond to those fairly quickly, so please do that. Of course, if you're now a comp provider, then certainly please reach out to their provider relations team.
Thank you so much, Rebecca. Thank you, Brian. I think we're going to close the webinar now, but just know that the recorded version of the webinar will be available on the MMIS website under Provider Notices. Thank you.
Thanks, everybody.
Thanks.